Yep, we're live.
Hello, I am here. Good evening, everyone. We are live tonight on the Eze Health webcast. I am pleased to again be joined by a great group of men for our third installment of Real Talk on Men's Health. I am joined by Dr. Richard Cook, uh, Deron Tross, and also Orlie Reid Jr. Thank you so much for joining us, guys.
My
So,
pleasure.
for those who have, watched the previous two episodes of this series, you know that we are talking all aspects of men's health from mental, social, emotional, and relational. And tonight, we're really going to highlight more about men's mental health and also exploring therapy as a means of solution in regards to, addressing men's mental health issues. Now, I usually like to start with having each of my guests introduce themselves, tell the audience a little bit about you, and anything else you'd like to share. And we'll start with Dr. Cook.
Well, thank you, Shinieri, for having me. We all appreciate the hard work you continue to do for your community and engaging uh, Black men with this forum. As important as that is, we know this type of information is for everybody. So thank you. It's good to see Deron again, and nice to meet Mr. Reid. Hopefully, our paths cross again in the near future. But quickly, I'm Dr. Richard Cook. I'm an internal medicine physician, been practicing for 20 years, board certified, president of the Charles County Medical Society. Have my own private practice in Waldorf, been here since 2005. And one of my passions is to help my community and uplift people by medicine and through any other means necessary to make sure that we follow through with the old saying, it takes a village. And I'm all about helping out the village be better. Thank you.
Wonderful. Thank you, Dr. Cook. And Deron?
Hey, I'm Deron Tross. I'm back. This segment number 3. Hint, hint. I hope we have a segment number 4. Um, I'm just, I'm involved in the community professionally. Uh, I'm a cybersecurity specialist. Work within the federal government. I'm a contractor. But at the end of the day, as Dr. Cook say, I'm all about helping my community out through conversations, conflict resolution.
Wonderful. Thank you, Darren. And Mr. Reid.
Good evening. Good evening. I also echo Dr. Cook's sentiments in reference to this forum. These type of activities are definitely necessary and continuing to grow and develop our community. And the conversation just needs to continue. I've been practicing in Waldorf. Well, I've been practicing for 22 years. Been living and practicing in Waldorf since 2005 as well. Also very involved in understanding and helping people identify what their abilities are through therapy, through mental health, and discovering that what they used to feel is trapping them is really part of their release. So they've been doing this for a lot of years. This is not just something that I love to do. It's actually my passion, something that I know I'm purposed to do. So,
Wonderful, wonderful. Thank you, Mr. Reid. We're so happy that you are able to join us tonight because I really want to delve deep into men's health and therapy as a solution to addressing these issues. Mental health is an increasing problem here in the U.S., especially in these challenging times. We're seeing rising rates of substance abuse, alcoholism, domestic abuse. People are really suffering. And men as well, the statistics are going up, not only for men, but Black men especially. So a lot of times there's this stigma surrounding mental health, mental wellness, getting therapy, getting help. And a lot of times I feel that people are kind of interchange the idea of mental health and mental illness.
mhm.
So if you could clarify, Mr. Reid, the difference between mental health and mental illness?
Okay, let's start with mental health. Mental health is mental wellness. It's just such as physical health. You want to make sure that you're checking in, making sure that you're clear and functioning. There is an interplay between the physical health as well as the mental health, and they're both interchange. Mental health is mental wellness. How do I feel? Is what I'm feeling contrary, or it does it support where I'm trying to go, the people that I'm associated with, the company that I keep, and also the work that I do? Am I functioning appropriately? Or am I having some abnormal functioning? That's when you move into mental illness. Is it disrupting my ability to be able to work? Is it disrupting my ability to be able to have communication with family? Is it disrupting my ability to be able to function as and actually engage in appropriate physical health? Am I eating appropriately? Am I sleeping appropriately? Is it causing a conflict in my ability to be able to see what's real versus what's not real? Am I having difficulty in managing and functioning normally, where every day I'm having a hard time even being able to get out of bed? That's when you move into the mental illness standpoint, something that affects your normal actual mental health functioning.
Right. So really understanding that distinction between the two. So you are a licensed therapist. You deal
Yes.
with clients every day. Um, and what are you finding, especially when it relates to men? Um, and also, I want the other Dr. Cook or Mr. Tross to also kind of comment on this kind of stigma that surrounds therapy or men seeking help through therapy. Is there some level of resistance that you find, say, Dr. Cook, when you want to refer one of your patients to a therapist or even a psychiatrist? Why are we finding this type of resistance sometimes amongst men?
Yeah, well, as Mr. Reid was saying, it's a really good idea to always correlate mental and physical. And you can tell he's been doing this for a while because he's getting straight to the point. But yes, men with any type of health have issues with going to the doctor and discussing it. And it's a lot of times how we were raised. We were raised to be quote unquote manly. And with being raised to be manly comes a whole bunch of stoic type of behaviors that tell us that we have to hold things in, hold things back, um, take things, not communicate. Uh, and that actually manifests in the lack of visits. One of the things I often tell my married men patients is that if you are married, you're going to live longer. Hint, hint, Mr. Tross. Uh, but that's very true because women will nudge their significant others, their men, to go to the doctor, and that's why they tend to live longer. But yes, um, I'm sure we'll just discuss more about the stoicism with men, but that's one of the main parts that make us vulnerable in not getting the proper help.
Dr. Cook just explained my situation. Hello, everyone that's out there. If you're back again, you know that I'm very transparent. Um, Mr. Reid is my therapist. I started seeing Mr. Reid about a year to 2 years before the pandemic. And when I went kicking and screaming. I was one of those types I was taught to be hard, as we say that word, man up.
Mhm.
Through this whole process, to back up, my physical health, I was one of those types. I would always have my physical. I would do all those things. But as far as my mental health, I wasn't dealing with that. I was always taught to just go to the Lord and pray. But we also know faith without works is dead. And once I started talking to Mr. Reid and my personal life, my uh, financial literacy, started, just thinking some things out. My personal relationship with others, the way I communicate with my kids, everything has gotten a lot better. But, I always tell folks, it's okay to go sit down and talk to someone. Because I had this whole thing in my mind that I was going to sit on a sofa and someone was going to be there with a tablet doing this and doing that, and it was completely opposite. Well, of course, when he stood up and I realized he was 6'4", 6'5", that kind of scared me. But I consider Mr. Reid and Coach Dr. Cook as a friend. And it's about being transparent. And even there was some people that I used to I would say friend, not friends, but associates. I realized through going through therapy, they were no longer they were no longer, I no longer needed them, because at the same time they were there, but they were part of the, and I hate this word. Some people on social media use it as toxic. I don't like that word, but they were not good for me. So I had to, guess what? Stop dealing with those folks, because I needed something positive. Because if you sit there and just think negative all day, guess what? You're gonna succumb to that. But again, thank you guys for being here to discuss it, being transparent, and Sherry, thank you as well. But it's the bottom line. You have to take care of your mental health.
Yeah, I know for me, what I experienced is that a lot of men coming in, I try to understand, get them to realize that what they're feeling is normal. What happens is we go through these things in our mind and we think that it's just us. It's just me. Something's wrong with me. And I can't expose that, because then now that's going to say that I'm weak and I'm not able to be the man that I'm supposed to be. So the real first step, a lot of times when I have men come in to see me, is really normalizing the whole situation. Hey, listen, we all go through. It's called human emotion. It's not called man. It's not called woman emotion. It's human emotion. We all feel. And now the idea is to take that strength of what you feel and apply it as something that can help develop you, instead of allowing it to be something that tears you down and destroying you from the inside out.
And yeah, you said something very poignant there in regards to just the humanity of having feelings. And it's not, and seeing feelings is something that we all experience. We all have emotions. Oftentimes, it's women that are viewed as highly emotional and, very sensitive. And there's this affiliation with having feelings or emotions to uh, being effeminate to some degree. So hence, Dr. Cook was saying the stoicism that men have, and almost resistance to the idea of addressing emotions and feelings, and getting mental health, support when it comes to this. So, what we're seeing now, and even what I see amongst my own patients, is increased anxiety, increased depression, and we know that it is presented differently in men versus women typically. So, in your experience, Orly, in regards to how men present with signs and symptoms of depression and anxiety, how do they present it typically different from women?
Men are more expressive physically, so you may see a higher increase in irritability, difficulty with anger control. Also, another thing you'll see, they'll start blaming those around them for the reason why they're going through. They're seeking to try to find a solution that's eluding them, and not realizing that solution is what's going on the inside. They also want to deny that they're having those feelings, especially depression, anxiety. I don't have those things. Nothing's wrong with me. It's what's going on outside around me. It's the people that I'm associated with. It's the job that I'm going to. It's the people. It's the kids that I have. That's what the problem is. Once that gets fixed, then I'll be okay. And so a lot of that is that idea of avoiding, but not just avoiding, but they also express those emotions through verbal non-gestures or nonverbal gestures. They also express it through facial expressions. One thing that also will happen if they're having conversations, you may recognize this when you're having a conversation, and you may say, "Hey, listen, lower your voice or lower your tone," and the man's like, "What are you talking about? I don't have a low. I didn't increase my tone. Nothing's wrong with my tone." They're going through something that they can't see, and the problem is that it's hard for us as men sometimes to identify that we're going through those things and going through those emotions, because our job is always looking at what we can do to fix it, what we can do to correct the problem, what's the solution. And there isn't really a hard time to focus on the solution when I'm dealing with what is going on the inside of me and I can't control it.
He Mr. Reid was 100% spot on. You know, as men, we have this thing. Well, I'm not going to let you disrespect me.
Mm-hmm.
And a lot of it's through therapy. I've learned, guess what? To just laugh that stuff off. I know who I am, and just keep it moving. But at the end of the day, that's also part of conflict resolution. Say, for instance, another gentleman step on your shoe. You know, you got your nice, pretty shoes on. You know, what do you mean stepping on my shoe? Hey, man, I was out in New Orleans about 3 weeks ago. As I'm walking, and bumped into a guy. What are you doing? I said, man, I apologize. I said, tell you what, let me buy you a drink. We sat there, me and him, and he would buy around. I bought around, and we had some other friends. We had a great time. Of course, we took an Uber, but it was all a part about the conflict resolution and brothers just having that conversation. You know, it wasn't trying to disrespect you or anyone else. So you have to understand that. And it's not just, and then I'm just talking about just African American men, just men as a whole. No one is trying to disrespect you. I understand when someone's trying to disrespect me. If I'm in a zone, I know how to, those triggers, I already know where I'm at. And, you know, it used to be, those triggers of mine used to be on high alert. Mm-hmm. Nowadays, I just sit and laugh it off. You know, it's amazing. And I think what Mr. Reid knows, I'm a football official, a basketball official. I'm on a collegiate level for football. There's no conflict resolution. It's a violent game, especially football. So you have to just, I laugh at it, have fun with it. But at the end of the day, it's to the point in my life, I allow nothing to get me to that level anymore. You know, in our community, we always talk about hypertension. Some folks don't know that's high blood pressure. High blood pressure and diabetes runs in my family. My mom used to take insulin twice a day. My grandmother was a diabetic. My grandfather was diabetic. I always said I did not want to be like them. I love them, don't get me wrong, but it's taking care of my physical health and my mental health. And we know, especially growing up in the South, I had a conversation with a cousin of mine who lives here now that, you know, about it. He needs to see a therapist, and he blew up. Wouldn't even talk to me for about almost 2 months. And his wife's a nurse, healthcare. She's in healthcare. And I said, hey, man, I noticed some things about the way we were raised with him. I said, hey, you know, if you continue to live like this, you're going to be a ticking time bomb. So it's important that we, as you know, I'm not saying diagnose the next brother or the next male, but it's okay if you have that relationship and say, hey, you know, maybe I'll see a therapist, or if you see your friend or a family member, hey, last time you had your physical. Anyone who knows me on my social media page, I'm always talking about my going to the doctor and my mental health. Open book, that's the only way you want to encourage us. I have had so many men approach me in the street and say, hey, man, thank you. I remember about 5 years ago, one of my fellow officials who was on my crew, he walked up to me and told me, we get to a site, say, hey, man, thank you. I was like, what's going on? He was diagnosed with the early stages of prostate cancer.
Oh, wow.
He hadn't had a physical in 6 years. I encouraged him to go to the doctor. Now Chad is living, breathing, got 3 grandkids, and he's still continuing to officiate football. But imagine had he not went to the doctor. You know, everything I always say, going to the doctor, if you diagnosed with something, that's a fight. You're giving yourself a fighting chance. You don't ever want that doctor. You don't want to be late. If you're late, nothing they can do for you. You know, besides give you some medicine and say, hey, you know, hopefully this would help. But if you go early detection, it helps. It's like your mental health. You know, there's folks walking around in this community, in every community. I call them ticking time bombs. Conflict resolution. And we need to understand how to de-escalate things and talk things out. It'll help us in our marriages, our personal relationships, on our jobs, financially, spiritually, all of that. It runs together.
Yeah, you guys said it all, but I'll just add one thing. Denial ain't just a river in Egypt. You know,
ooh, that's a sermon, Doc.
But I'll be short. The question is why? You know, why in the physical and mental are we in denial? And I think part of that is part of the stoicism. It's learned behavior. But the great thing about what is learned, it can be unlearned, and that's why we have forums like this. This type of healthcare, mental health care specifically, has to be reared from the time we come out of our mom's bellies.
Mhm.
It is, just as we've all said, like the physical. And just like the physical, you have to do it often to stay in shape. And what happens physically if you stop exercising, you get out of shape. So mental health is continuous, it's lifelong, and should be implemented in every single life aspect of all of us. And when I meant denial, that wasn't in a negative connotation. That's just part of that rearing that I think a lot of us men have, and we learn it, and we learn to ignore it. So we have to make sure that these type of forums and others in school, in church, everywhere, parents, because that's where we get a lot of our information from.
Mhm.
Learn mental health.
Let me ask you, can I ask a quick question, Dr. Cook? And Mr. Reid, you may know this. I always had a good relationship with my doctors, neurologists, you name it. But I find that having that hold from a mental health, being able to discuss what's going on with your body. Of course, you can go see the doctor, they can run a bunch of tests. But the doctor's running these tests, but it has to be some type of communication between the patient and the doctor, because they can only diagnose what's going on, what they see on paper. But you have to tell them what's going on. I need to know where it hurts at. I need to know what's going on. So, and when we talk about mental health, that communication aspect, I'm about to answer my own question. It's great to have that communication aspect with your therapist and your medical doctor, or whatever doctor that you're seeing, because it's going to help you, because it's all mental at this point. I had a friend of mine tell me a couple weeks ago who had breast cancer. By the way, he was a male, a black male, breast cancer. A lot of folks, Richard Roundtree, a lot of folks don't understand that. He said, early detection was the thing. When he found out that he had breast cancer, like, I'm a male, how did this happen? And we sitting there talking, and I said, this is how it happens. It just doesn't affect women, it affects black male. And I said, you just like the women in the shower, you do your whole inspect, you have to inspect your whole body. Early detection. But once you detect it, you have to be able to talk to your doctor and let your doctor, so your doctor you can sit down and talk about different avenues of how you going to approach this. But it's all mental. If you feeling fine mentally, the other piece is going to help. The mind and the body works together.
Yeah. And that's the counterintuitive of what a lot of people were raised, especially men, how we're raised. We're not raised to go to somebody else. We're raised to be able to do it ourselves. We're supposed to be the one that's supposed to be a provider. We're supposed to be the one that's supposed to figure things out. We're supposed to be the go-to. So that becomes the identity of how we see ourselves. So why should I have to go to somebody else to tell me about myself? I know about me already.
Yeah, and to piggyback on what Deron and Mr. Reid said, I think it might help everyone out there to know that when you have someone who practices a specialty, one, we're not judging. Two, we see this every day, and so it's like Tuesday, it's Thursday, it's so we look at it as a concrete and common sense medical visit. And let me give you an example of what I mean by that. I do prostate exams every day, and most men who come are very anxious about it.
Mhm.
But just to let everyone else out there know, since we are doing this every day, it is normal to us. We're not judging. We're just doing our job, and we want to make sure you feel like you're not being judged as well, whether it's mental health or getting your physical exam.
Yeah.
You hit prostate. Let's go there for a second. I remember with me, I was in the military. I got out, but I started having some issues and it was taboo for me. I didn't want to go. I had my first prostate exam. I was 42 years old. I didn't want to go. Trust me. I went on an advice of a friend, and I really think it saved my life. I was diagnosed with a condition called prostatitis. Instead of going every 5 or 7 years, whatever, I go every 2 years. Early detection. I don't have prostate cancer. Anyone listening to this, but early detection, because my doctor understands what's going on. And for me, I was so annoyed with this whole, in my mind, I found me a female doctor because I didn't want to see a male doctor. But the most important thing is I went. And, you know, my urologist, she was able to do my my other procedures that I had. But my vasectomy, that's what I'm talking about for the guys out there. Go get one of those too if you need one. But the key is we could have, we talk, we joke, and we have that relationship. You know, and she's in Virginia. There's a lot of times when I can't get to Virginia. If I need to, you know, I need something done, I go see her, Shaneri. And she'll tell you, we have conversations about health, because I'll give it to me straight. Just like when I go see Mr. Reid, give it to me straight. I need to know what I'm dealing with. I need to have a plan. So if any man out there, whether it be black, white, blue, green, see a doctor. It's important, male or female. I know you, Shaneri knows I have to leave because I have another meeting, but I wanted to say this here in closing. Shaneri, you need to do this again. Hint, hint. You know, when Jesus, and not to get religious on you, when Jesus was on the road after the cross, there was a woman. There was a woman. There was a woman. Shaneri, I'm not comparing you to that woman, but you put this together. It's a woman. It's a woman. This is your ministry. Keep doing it, please. I look forward to, whether it be, if I'm not involved, I want to take part of it, listen to it, but please continue to do this. This is great. I met two other brothers, Jeffrey and another gentleman from Baltimore that are not here tonight, but friendship with them. There's an old song in the Baptist church, let us commune together.
Yeah.
This is right here is commune. I'm not preaching a sermon. I'm a PK kid though. But at the end of the day, thank you guys. Thank you guys. I'm gonna run off because I have a football meeting here at 7 that popped up. But Shaneri, hint, do this again, please.
All right. We'll see. Well, thank you, Deron. Your transparency means a lot, and definitely appreciate you sharing your insight and being very open about it. Thank you.
One last thing to the audience that are listening. As I said, Mr. Reid is my therapist. Before we got on, we were joking, and I realized I hadn't made my appointment. So while we were, before everyone got online, I was like, oh, I need to make an appointment. That was my reminder. But again, folks, go to your doctors, have your mentally, physically, do it. Do it for your loved ones. Remember, 99 and a half won't do it. Trying to make 100.
Absolutely.
Have a good one.
Good evening.
Good evening. Have a good evening. Appreciate you, Deron.
Take care.
Love you, brothers.
All right.
Likewise, my friend.
Likewise.
All right. So the conversation shall continue. Again, thank you so much for hanging on, guys. I know we're missing a couple of guys. Jeff was supposed to come out, but he did have a family emergency. And again, I appreciate you taking the time, but this is a very important conversation. So let the conversation continue. Deron touched upon a couple of things, and one of them is just the importance of normalizing therapy, normalizing going and getting help when you need it, not waiting until it escalates to the point of an outburst, or we're seeing mass shootings. You were saying earlier, Mr. Reid, how men tend to respond and react physically in ways when there is maybe an underlying mental health or emotional issue. I think part of it is coming from how men are socialized in this society, to telling little boys who are crying to quote unquote man up, and to suppress their emotions and not be expressive and not show your feelings, but rather be stoic, be obsolete and just not showing anything, but almost be reactive. It's expected to be aggressive.
Mhm.
So how do we address just kind of changing around the socialization of boys to embrace their feelings and emotions and not let it manifest in a negative way? Oops.
Mhm. Well, I would say first it starts in the home. Is we have a running joke here in my house. My wife is also a therapist, and so we joke around a lot with each other about our kids would rather just get punished than get talked to, because our job. Because my thing is that I not only want you to be able to identify what you're doing is wrong, but I want you to
Mhm.
understand why it's wrong. And that part of adding in that extra communication, and then also how are your feelings attached to this? It may not feel good for me coming down on you. It may not feel good of this experience that you're going through, but that emotion is there for a reason. It's there for a purpose. It's there to teach you. It's there to help you deal with whatever it is, so that a negative emotion doesn't happen again. So really opening up and understanding that men have feelings, boys have feelings, boys have emotions, and it's okay to express it appropriately and in the right venue. A lot of that too comes with even with teams. I did some coaching for basketball and different things like that. And one thing that we would do is deal with the kids in their emotions, especially when things get heated and they get frustrated. And we have talks about why are you frustrated? What's causing that feeling? What's causing that emotion? And now what are you going to do about it? It's not just what you feel, it's how you choose to function even after you feel. That taking that next step of helping, especially boys, process through those emotions instead of saying, you know what, ignore it.
So it
Yeah.
starts.
Oh, I'm
Oh, go
sorry.
ahead.
Go ahead.
No, go ahead. Sorry.
Well, life is hard. There's so many things that we have to learn in life, but as the two gentlemen and you have already stated, it's easier when you start early, and the more people you have involved in decreasing the stigma, making sure you teach self-seeking help, um, uh, conditions, and making sure that this is an integral part of the family, the church, the school, sports, anything and everything, just like you do with gym or learning math. Um, this helps whatever patient open up the doors to get help more.
Mhm.
Right. And I think when it comes to the upbringing of children, um, allowing the boys to show, allowing your sons to show emotion just like you allow your daughters to show emotion, getting out of this idea of how boys should behave or act or how they should kind of mask their emotions. I think hopefully in society we're moving away from that.
Mhm.
Um, that way of raising our children, because it's so important now. We're seeing how mental health in men is increasingly important and how that impacts society as a whole. I mentioned earlier about, mass shootings and how they're finding that they tend to, the perpetrators tend to follow a certain profile, where there are some mental health issues, there may be some mental illness issues, these, you know, uh, incidents of domestic violence, how men are tending to use aggressiveness because of suppressed emotions. A part of that may be suppressed emotions. I mean, would you say that could be
Mhm.
a factor?
Yeah. I would say it's compound pressure. So what happens is not just one incident, it's the multiple incidents that don't get dealt with that keeps getting pushed under the rug. It's like a balloon. You take a balloon, start putting air into that balloon, eventually it's going to get to the point where that balloon's going to pop. Take that same balloon, put a hole in the bottom of it, and you keep on putting air into it. The air has a way of escape. The idea isn't changing the balloon or changing the air. It's teaching men how to have a release point. If you don't have a release point, there will be an explosion. And that explosion looks like the mass shootings. It looks like you had mentioned earlier, the slap of Will Smith slapping somebody, that pressure that builds up where there is no release or no appropriation of how I can release this feeling that I'm having. And these multiple feelings that keep on getting pushed down, they have to go somewhere. It's about energy. Energy can't just sit, it has to move.
Right. So when it comes to how men perceive themselves and self-esteem amongst men, how does that kind of interplay in, this talk of mental health amongst men?
I'll let Mr. Reid take that one first.
So low
Well,
self-esteem in men
yeah.
who perceive themselves negatively, how does that impact?
Well, you're also going to see that they're going to try to control their environment more. They want to control the people around them. They want to control their associations. A lot of times when you look at men that are abusive, a lot of the men that are abusive have low self-esteem. So the way that I can control how I feel about myself internally is to control the people around me emotionally. So as long as I can control their emotions, then I'm not the problem, they are.
Oh, wow.
Yeah, and I think what might happen when someone does have low self-esteem, it's almost liking it to depression. You're likely not going to be the person who wants to take care of themselves.
Mhm.
So say if someone has depression, are they going to eat celery sticks and carrots all the time? No, they'll probably go into more destructive behaviors and eating habits. Same thing with the self-esteem. I think you can have destructive behaviors as part of your release, as Mr. Reid said, and that person is obviously in probably in denial as well. But if you have people around you that love you and you have good friends and you hang around a good support structure, you can get help. But if you don't, just like with drugs and gambling and smoking and eating addictions, you will go down a path of addiction and bad health, and the outcomes usually aren't good. So that's how I think about that as far as what you just mentioned.
Mhm.
So even relationally, how when a man is suffering emotionally, whether it's suppressed emotions, depression, anxiety, low self-esteem, how does that typically translate in their relational interactions, whether it's with coworkers, spouses, children, partners? How do we see men manifest these things through their relationships when they are suffering with mental health issues?
Well, unfortunately, a lot of times us men become very good at hiding it. And so I call it the chameleon effect. We know how to put on the good face, act like everything's okay, and suffer in silence. And so, yeah, we may be engaged, we may be smiling, we may be interactive, we even may be being the model husband. But on the inside, what's happening is that we're not allowing ourselves to really live out what we're really feeling, what's really going on. For instance, that's also, I was going to talk about this a little bit about, we have this thing about what a midlife crisis, right? So what is the midlife crisis? I get to ask this question a lot. What's the midlife crisis? Well, really what happens is you have a man that's been for years, his only focus has been doing what a man's supposed to do, quote unquote, what a man's supposed to do, take care of his family, take care of his kids, work a good job, and just that's just, handle your business. But what happens, he gets to a point where he starts realizing his maturation, his maturity, and also his mortality. And now he's at a point where he's like, okay, what have I done with my life? What am I doing for me? Now I have to look at what's going on for me. I've realized that I've lived so many years for other people. Now I want to live for me. So what happens is sometimes they completely change their identity, who they are. They start looking for things that can give them self-gratification. That's when you start seeing them getting a new car and changing their appearance and working on getting their body in order, because they're looking for that self-internal validation that they didn't allow themselves to experience normally as the maturation, as they were getting older, as they were growing up. So that now it becomes this dramatic change instead of something that they've been dealing with and allowing themselves to experience their whole life.
Yeah, and with low self-esteem, we have to also understand that the person might not know they're suffering from low
Mhm.
self-esteem
Mm,
because they'll be manifested in other ways. And I think we've already mentioned those other ways,
Mhm.
but what you don't know, you don't know. And a lot of times that will be scapegoated into other bad behaviors, be
Yes.
it with relationships, be it performance at work issues, um, be it sleeping too much,
Mhm.
um, pretty much behaviors that get in the way of leading a productive life, taking care of your kids, and so forth. And that's why, as we've all said, it's so vitally important to not only teach this recognition as early as possible, but part of that recognition should be to go to your doctor, go to your
Mhm.
therapist. Everyone needs both of those at some point in their life so they can learn them, just like you learn how to exercise correctly, and you do that for the remainder of your life. Just like we don't all get a textbook on how to raise children and we kind of wing it, there are textbooks out there on how to do it
Yeah.
the proper way. Take care of your house, take care of your car, and so forth. There's no more important thing on this planet than the human body and taking care of yourself and others around you.
right, absolutely. So, you mentioned, Dr. Cook, how there may be men that don't even recognize that they are dealing with a mental health problem. Um, they may not recognize it. They may be in denial of it. They may be putting on a mask, what have you. So now it may take someone else observing certain changes in their behavior, changes in their appearance, the way they talk, the things they do. Like, what are some key things that we need to look for? Whether it's a brother, a father, a friend, a coworker, where we suspect that they're suffering from something emotionally or mentally. They may not say anything, but what are some of the key signs to look for? And then what are the next steps?
Mhm.
Yeah, we've mentioned a good amount of them, and I'll comment on some of those again. But we mentioned appearance.
Mhm.
We mentioned poor sleep, whether it's too much or too little. We mentioned eating habits, work habits, relationship issues, um, isolation, taking care of your responsibilities or not. And this is important for you to have someone that does know you well, whether it's the pastor of your church or your therapist or what have you, because this can be related to anything, whether it's you're doing too much drinking, or you have a food addiction. Um, Sometimes it does take someone else looking in to see that there is an issue. So those are some of the things I'd be looking out for.
Well, Dr. Cook ran through most of them, so I appreciate. And really, just looking at patterns, pattern changes. Is there anything that's different or unusual that they're doing that they're not used to doing? Especially if that unusual takes them out of their performance, of their health, of their being able to do work their job, and also out of their relationships. A lot of times, us men, we see things and don't say things. And unfortunately, sometimes that can be to the detriment, because I may see something that my friend's going through that even his wife may not see, because I know him, and he may be exposing some things to me that he may not expose to his wife. So my job as his friend is to be the friend. Hey, listen, I'm noticing this, and this. I've done that with a couple friends before, and they've done that with me, and that goes to a larger issue too. Dr. Cook touched on this a few times. Your circle, who's around you. You got to understand, we're not made to go through life by ourselves. But however, when we are going through those emotions, we want to be by ourselves. So I engage what I call the law of opposites. You have to be willing to do the opposite of what you feel like doing, because as long as you're identifying the feeling is what's going to lead. And that feeling is going to lead you in the same pit that you're staying, that you're already in. And it's just going to get deeper.
Yeah, and it's so important that we catch these signs early. Um, and not, uh, dismiss it or be hesitant to approach our friend, coworker, whoever that male, may be, out of fear of, being too intrusive or, being nosy or not, it really takes, caring for that individual when you see something isn't right and saying something. Um, Now, I want to transition to a sensitive topic and one that tends to be fairly taboo, even within our community, especially. And that is the subject of suicide.
Mhm.
We are seeing rising rates of suicide in general, but especially among Black men. I do want to share a statistic from February 2022 article from Observer magazine, and that cites the Journal of the American Medical Association, stating that Black males had the highest increase in suicide attempts compared to any other race in the studied group. So that's one statistic. Another states the American Foundation for Suicide Prevention shared that in 2017, men died by suicide at a rate of 3.54% higher than women. And depression and suicide are considered the leading causes of death among men. So, what do you feel are the things that are contributing to these rising rates of suicide, especially among Black men in particular?
Well, I can say for men, there's sort of three basic needs. All right, you have a need for identity, a need for companionship, and a need for a purpose. And so when we talk about the suicide and what's going on with suicide rate, you're looking at a void of, if not two, at least three of those things, where they may have difficulty in establishing who they are through their job, who they are through their associations and family, who they are, how they see themselves in relation to how they live, where they feel they should be, that they're not. Companionship, what type of relationships do they have? Are they in significant relationships? How are those relationships investing in how they're growing? And then also purpose. Who are they, and what are they supposed to do here? Are they doing what they love to do? Are they doing something that they're passionate about? I've had, like Dr. Cook had talked about, this is our normal work. So I've worked with clients who are on suicide watch, those who are dealing with suicidal ideation. And a lot of times, one thing that I figure out is that people really don't want to kill themselves. They really don't. They really don't.
Mm.
It's just that they feel they have no other option because things aren't working out. They're hurting so bad and they feel like nobody sees them. So part of it is becoming visible, helping them identify where they fit, helping them find their value, and helping them reestablish their identity.
Beautifully said, Mr. Reid. We have to really make sure people understand that mental disease, mental illness, is just as real as hypertension, high cholesterol, diabetes, a broken rib, gallstones, etc. And unless you get the proper treatment, those chemical imbalances are going to have you thinking in a different way.
Yes.
You don't have much control over that, and that's serious business. Now, as that relates to this study, I have a couple things to say about that. One is we have to make sure everyone out there knows about suicidal ideation, suicidal attempts, and committing suicide and being successful at it. White men are the most successful at committing suicide and going through with it. As you mentioned in this study, the males were the most successful. I believe this was an adolescent study, though. Um, and of course, ideation is just the thought of it. Correct me if I'm wrong, Mr. Reid.
We're correct. Yes.
Um, so when you have a group of men who manifest their manliness with the physical, as Mr. Reid has said, um, and through that whole spectrum of ideation, attempts, and committing suicides, we're good at it. We're going to be good at it, and that's very well known. One of the things that was of interest to this study. Because, as an internist, we are known to be some of the best breakdowners of studies. What was one, when you look at the population that was studied, it was based on ER visits, and probably a lot of it had to do with attempts with drugs and overdoses. And I would like to see how they define that. Did they
Mhm.
define it as someone who was obtunded and just a little out of it because they just were very high, or were they really trying to, kill themselves? And how do you determine if someone is in the right state of mind to ask them that when it's going on, or is that done afterwards? I didn't see that in the study. And the other thing you have to look at is the study is from 91 to almost present, which is an outstanding study, almost 200,000 people. That really goes to show you, if you have read anything about mental health history, what happened to the funding of mental health. Uh, I'm not calling it any party out, but during the Reagan years, and it's almost like this study was written for that. Every single year since the Reagan years, funding for mental health has been cut. What do you think is going to happen if you cut funding to education in colleges and so forth? People are not going to be as smart, and as you cut mental and or physical health spending, people aren't going to be as mentally and physical healthy. So that's the other thing. And the last thing I'll say is that um, when you cut funding across the board, not only for healthcare but social programs, you tend to have people who are unhappier. And if you look at the happy index of the US, it's very, very low compared to other European and Scandinavian countries. So if we invest in these things to make us healthier across the board, just like we invest in our firemen, in our public libraries, in our school system, we are going to probably see a lot less of this. Of course, there's some racial undertones and systemic racism and so forth in our community that we've talked about before on these podcasts. But that's what I think about when I hear about both of these studies.
So what is the solution? We've talked tonight about the different elements of mental health in men, and how to identify, when there's issues. Um, we have an audience who may be men, maybe the spouses, friends, etc. Um, and the underlying question is, what is the next step? How does one get started, even with saying or recognizing, hey, there's something going on, I have an issue. um, who do I seek? I think, we mentioned going to the doctor first. um, what is the impetus for someone to then go forth to seek a therapist, a counselor, or mental health support?
May I take this one? I'll be brief because I know Mr. Reed's going to take it home for us. So one of the things I often tell my patients is to be a kid again. Learn to laugh, go out and have fun,
Mhm.
walk in the sunshine, put the cell phone down, get good rest, eat properly, exercise, listen to music, laugh. And the other thing I'll say is that we had mentioned earlier that Charles County is the richest minority majority county in the country now. Most of our patients, I think I can probably speak for Mr. Reed, but most of our patients have insurance.
Yes.
There's no reason that they should not be using it, because third world countries would love to be in our position. And when you use it, do both mental and physical. You'll learn it just like a personal trainer will teach you some things to learn, and then you can go off and do most of these things on your own, because the longest living people on the planet aren't seeing doctors often. They've learned how to do things right. Thanks.
Mhm. And also, it's about understanding what therapy actually is. Let me just make it easy. So, if you're going through a problem, you're going through issue, you want to go talk to a friend about how solutions on how you can better solve that issue. It's still something you got to solve. It's still something you got to go through. You're just looking for advice. That's therapy. And so the idea is that as a therapist, I'm just trained to be able to help you get to your end result in a more sufficient way, and being able to also help deal with there may be some mental illness or some mental issues that are actually compounding that you can't see. And I'm there to help sort of peel the onion or to expose those. But really, when it comes down to it, it's really just about understanding that I go through things just like everybody else goes through. And if I didn't have anybody to talk to, I probably might be in the same position you're in or even worse. So it's not that, do I need to go see a therapist? Do I need to go talk to somebody? One thing I tell everybody is that we all need to talk to somebody. That's just reality.
Mm.
Especially in the world that we live in with the social media. We have this social media thing that's supposed to be connecting everyone, but it's actually causing more dissension because we spend so much time in the virtual world that we don't know how to live reality. And because we don't know how to live reality, we don't know how to relate to one another. So part of it too is just that relational functioning. As a company, that you see that, and it's a multi-tiered layers as to why things are the way they are. But if you really look at how even communication happens, even with teenagers, they can text message all day long. You sit them in a room next to each other, they have a hard time communicating full sentences. And it's not because they're not smart. It's not because they're not intelligent. It's just they don't need to utilize that because it's not necessary. So part of it is, like the doctor said, putting down the cell phone, getting out, enjoying life, enjoying one another, because we spend so much of our lives looking down at our phone while we have somebody that is some more engaging, sitting right in front of us, another person who has life, another living being. But yet we're so enamored by this cell phone. And I have to challenge myself with that too, because I have to say, you know what, whenever I'm with my family or my kids, cell phone goes down, because it's easy to get distracted by those type of things. And so if you're like me, you're a person that's easily distracted by the cell phone. If you're a person that goes through issues that it's hard for you to even talk to somebody that's next to you that you care about, because you know that it may even have implications on them going through something. If you have an issue where you're feeling a certain way that you don't like feeling, if you have difficulty being able to communicate effectively in a way that you want to be able to communicate, if you have difficulty in understanding what some of the diagnoses that you have, there's one thing that Dr. Cook, even, I'm sure he'll agree with me, is that when you get diagnosed with something that can be a physical condition, that will cause a mental health issue, that can cause depression, that can cause anxiety. So that's why a lot of times, which I'm glad to hear, Dr. Cook and many of his counterparts, they'll refer out for therapy just to help you understand that you're not alone. Somebody can help walk you through this. There's a way that you can handle this. There's a way that you can deal with this.
And vice versa.
Yes.
Brain to the body, body to the brain.
Yes. And that's one thing during our initial sessions. One of the first things we ask: when was your last physical? Mm-hmm. That's so important. What were the results of your physical? Were there any inconsistencies in your physical? Because we know that the interplay of the physical has impact on the mental. So there may be something going on with your physical that causes the chemical imbalance that causes difficulty with your mental functioning.
Absolutely. Wow. This was amazing. Very informative. Thank you, gentlemen, for joining us this evening. I definitely don't want to leave the audience without some resources that they can actually seek, whether it's a website. Orlie, if you want to also share your information and contact information, or you are taking new clients.
Yes.
Yes. So I would love to allow you to, this opportunity to, mention the services that you offer. Dr. Cook, you the same. And if there are any resources, materials that you would like to share with the audience, please do. Orlie, I'm going to start with you. If you could just share with the audience how they can get in contact with you.
Sure. We have a website that we use for referrals. It's Rhema Counseling Services, and you spell it like this: it's www.rhema, spelled RHEMA, counseling and services, which is abbreviated SVCS. S is in Sam, V is in Victor, C is in Cat, S is in Sam.com. Rhema Counseling Services. On there, you can see the host of what therapists we have available. We have myself, and also we have 2 other therapists, my wife and also another business partner of ours that also takes on therapy, that also takes on clientele. We accept Care First, Blue Cross Blue Shield, Cigna, Aetna, and United Behavioral Health Care insurances.
Wonderful. And Dr. Cook, are there any resources that you would like to share with our audience?
My resource is myself going into the community and doing podcasts and mental health fairs like this. I'm unfortunately not accepting any new patients at this time, but I think most people who know me through social media and around the community know I'm very passionate and involved in these type of events, and I'll continue to do these type of events. So we'll see you, as Deron said, for that 4th one.
Yeah, right.
Part 4, it just
Don't
keeps
forget about
going.
me. I want to be part of this 4th one too.
Oh yeah, we got to bring Brother Reid back.
Oh, absolutely. Absolutely. Yes, this was great. Thank you, gentlemen, for joining us this evening. I know we had a small group, but still just as informative, just as engaging. I appreciate your time. Thank you to the audience for joining us. It appears that I have been encouraged to do a part 4. So we will let you all know when we have the next part coming. Thank you all. Have a great evening.
Thank you for having me.
Thank you so much for this
Y'all have a good night.
opportunity. You have a great night.
Good night.